Okay, so healthcare. It often feels, well, complicated, doesn't it? Costs seem to keep rising, the systems can be confusing.
Yeah, it's a lot for anyone to navigate.
Exactly. But there's this huge global shift happening, trying to change all that. It's called value-based healthcare, or VBHC.
hmm And it's really picking up steam, moving away from that old model.
The fee-for-service one, where doctors get paid for, like, how much stuff they do.
Precisely. Instead of quantity, VBHC focuses squarely on the quality of the outcomes. How much healthier does the patient actually get?
Right. So that's what we're digging into today. What VBHC really is, how it changes the definition of success in healthcare, and why getting the right help, that strategic guidance, is so vital to making it work.
It's a good topic because value here is, well, it's defined very specifically. It's more than just some management buzzword.
Okay, so break that down.
Yeah.
What is value in VBHC?
It's the health outcomes achieved for the amount of money spent. So results per dollar, essentially.
Ah, okay. That flips the script, doesn't it? It's not just activity anymore.
Not at all.
Hmm.
It forces a focus on effectiveness and efficiency tied directly to patient health.
And I guess that connects to some core ideas behind it, like preventing problems before they start.
Absolutely. Prevention and early intervention are huge. Why wait until someone is really sick if you can keep them healthier in the first place?
Makes sense. Cheaper, too, probably.
Often, yes.
Hmm.
And it requires much better coordinated care, making sure care is seamless, between your family doctor, specialists, the hospital.
Yeah, avoiding that feeling of being bounced around.
Exactly. And measuring what matters the actual patient outcomes. Did the treatment work? How's the patient's quality of life? Not just counting how many appointments they had.
So it really puts the patient's actual health journey front and center.
It does. And critically, it tries to align the incentives. Get the payers, the providers, even the patients, all aiming for the same value-driven goals.
That sounds big. I mean, how do you actually do that? Shifting a whole system like that.
It's definitely a major undertaking. Operationally, you need some serious infrastructure.
Like what?
Robust data analytics, for one. Strong clinical governance, ways to measure performance constantly, and a real commitment to continuous quality improvement. It's complex stuff.
Yeah, sounds like it. You probably need specialized help to build all that.
Very often, yes. Most healthcare organizations don't have that kind of specific expertise just sitting there. They need partners to bridge that gap between understanding the idea and actually implementing it day to day.
Okay, so let's talk about that implementation gap. What are the biggest roadblocks organizations hit when they try to switch to VBHC? And how does a consultancy, like, say, Smart Management Consultancy, help them navigate that?
That's a great question. A huge hurdle is often just inertia. Resistance to changing how things have always been done, especially redefining success.
Right, moving away from just volume.
Exactly. And that's where Smart Management Consultancy comes in. They work across Bahrain and the GCC, and they've structured their approach around 6 key pillars to tackle this.
6 pillars.
Yeah.
Okay, what's the first one?
Strategic alignment. This is fundamental. They work with the leadership executives, clinical heads, to really redefine success, shifting that focus from service, volume squarely, onto patient outcomes and value.
So getting the bosses and the doctors all singing from the same song sheet, focused on the patient?
Pretty much. It's about making sure the organization's goals genuinely align with creating value for patients. That often means tackling some deep-seated ideas about revenue and care delivery.
I can imagine that's a challenge. What's a common pushback they get there? Like, won't focusing on outcomes hurt our bottom line?
That's a classic one. But the reality is, optimizing for value often leads to more sustainable finances by improving efficiency and patient loyalty. It's not about spending less necessarily, but spending smarter.
Okay, so you get the strategy aligned. How do you measure if it's working? Which brings us to pillar 2, right? Data-driven performance management.
Precisely. You absolutely need good, actionable data. And it's not just about looking backwards anymore. The goal is to use data predictively.
Predictively. How so?
Well, the consultancy helps set up key performance indicators, dashboards, clinical audits, all tracking outcomes, costs, how services are used. This lets you see in real time what's working, what isn't, maybe even identify patients at risk before something goes wrong.
Ah, I see. Using data to steer the ship, not just check the logbook.
You got it. It becomes a tool for active management and improvement.
Okay, strategies aligned, data's flowing, but you need the people on board, right? The staff actually delivering the care.
Absolutely crucial. Which leads to pillar 3, capacity building and training. This is all about the human element.
So teaching everyone this new way of thinking.
Exactly. They run NHRA-accredited training, workshops, coaching, focusing on things like quality management, patient safety, clinical governance, performance improvement, and specifically leadership skills for this value-based world.
NHRA, that's the National Health Regulatory Authority in Bahrain.
That's right. So it's recognized, high-quality training. The goal is to get everyone, from the bedside nurse to the CEO, understanding their role in delivering value, speaking the same language, basically.
Speaking the same language of value. I like that. Okay, so if everyone's trained up and aligned, the next logical step seems to be fixing the actual processes. Pillar 4.
Workflow redesign and process optimization. Yep. This is about rolling up your sleeves and looking at how care is actually delivered.
Finding the bottlenecks, the waste.
Exactly. Re-engineering workflows to make them smoother, more coordinated, more efficient. They focus particularly on high-impact areas.
Like what? Give me an example.
Chronic disease management is a big one. Redesigning that pathway to better connect primary care specialists, maybe even home care, to keep people stable and out of the hospital, or optimizing emergency department flow to cut wait times and get patients the right care faster.
Okay, yeah, those sound like areas where improvements would make a huge difference, both for patients and costs.
Definitely. Tangible improvements that impact outcomes directly.
Which feels like it would tie into accreditation, right? Pillar 5. Accreditation, readiness, and compliance. Are those naturally linked?
They really are. Accreditation bodies increasingly demand evidence of quality outcomes and patient-centered processes, which are the heart of VBHC.
So implementing VBHC helps you get accredited.
It absolutely does. Smart Management Consultancy helps clients achieve various accreditations. NHRA in Bahrain, CBHI in Saudi Arabia, GAR in Egypt, even international ones like JCI or Accreditation Canada.
How do they do that?
By embedding these value-based practices right into the core systems, the care pathways, how things are documented, the safety protocols, the governance structures, it becomes part of the organizational DNA.
So it's not just prepping for a survey, it's building the quality in from the ground up.
That's the idea. Sustainable compliance through genuine quality improvement.
Okay, one pillar left. Number 6, patient experience and engagement. This feels really central to the whole value idea.
It absolutely is. Sometimes people think of patient experience as, a soft metric.
Yeah, like the waiting room niceness.
Yeah, right. But in VBHC, it's critical. If the patient doesn't feel their needs were met, if they aren't satisfied, if they don't feel better in ways that matter to them, did we really deliver value?
Good point. How do you measure that effectively?
The consultancy provides tools, surveys, frameworks to systematically measure, analyze, and then improve the patient experience. It makes it a concrete, actionable part of the value equation, not just an afterthought.
Okay, those 6 pillars together sound incredibly thorough. It's not just tweaking things. It's a real system overhaul. What kind of results do organizations actually see from this kind of partnership?
The results are usually quite tangible. We see higher patient satisfaction scores, definitely. Reductions in things like unnecessary hospital readmissions or preventable errors.
Better clinical outcomes, too.
Yes, improved clinical outcomes, better quality and documentation, which is also important, and overall, stronger governance and accountability throughout the organization.
So it's about building systems that last, not just quick fixes.
Exactly. Sustainable excellence, long-term compliance, better care, and often more efficient operations, too.
So looking ahead, especially for places like Bahrain and the wider region, is VBHC just a nice idea, or is it becoming essential?
I'd say it's rapidly moving towards essential. As healthcare systems everywhere reform and face cost pressures, this focus on value is really the path forward for sustainability and success.
And navigating that path requires some expertise.
It really does. You need advisors who get the strategy, the technical side, and the people side, the coaching and culture change. That's the kind of mix Smart Management Consultancy brings, helping organizations build the systems and skills they need.
Whether they're aiming for accreditation, cost savings, better patient outcomes,
Yeah.
or just future-proofing their facility.
Precisely. It's about leading them into this next era of healthcare.
It really does offer a different way to think about healthcare, doesn't it? Seeing how quality and efficiency can actually work together.
It's a powerful framework.
So, here's something to think about. If value in healthcare truly becomes about getting the best outcomes for the money spent, what could that mean for your own health journey? Imagine a system where every single part is incentivized to help you get better, faster, and stay well longer. How might that change how you interact with your doctors, with hospitals, moving beyond just treating sickness to supporting your overall well-being?